We at AfyaAccess, and we believe that access to quality healthcare should not be a privilege, it should be a right. But you have millions of people living in the rural areas in Kenya who are still struggling to get even the basic medical services. We are a team of five: Benjamin, Billy, Lucy, Nyaga, and myself. And together, we're working on a solution that leverages technology, sustainability, and security to bridge the gap of healthcare in the rural areas. Over 15 million people in rural Kenya lack access to affordable healthcare. For them, seeing a doctor is all about distance, cost, and uncertainty. They may travel for long distances only to find long queues, no specialists, and no medicines. And at times, there is no proper record keeping. To understand the urgency of this problem, let's meet Zawadi Mwende. Zawadi is a subsistent farmer and a mother of two young children in rural Kisumu County. She works tirelessly to provide for her family, and when her children fall sick, she has to walk for 20 kilometers to the nearest clinic. Zawadi's story is not unique. It is the reality of millions of people living in the rural areas in Kenya. Our solution is to implement solar powered telemedicine kiosks in rural Kenya. This kiosk would be strategically placed in the rural areas. It will enable patients without smartphone access to receive remote consultations and healthcare services. AfyaAccess is integrating a blockchain based system to securely manage and protect medical records.
In Kenya, we have a total of 9,630 health facilities which are distributed across the nation. Nairobi has 942 of them, being the highest, and Lamu has 47, being the lowest. When you look at the healthcare workforce, it is very much disheartening to realize that in a population of 10,000 people, the workforce is 15.6. Tarakaniti County has the highest with a percentage of 33.8, while Turkana has the lowest with a percentage of 7.4. In the prototype, one of the major key screens you'll notice is the user registration, consultations and booking, and also medical access records. Below is how the prototype will look like.
And now we believe our solution is feasible and workable because through this particular solution, we're going to cut down the medical expenses cost. And then by leveraging the sustainable technology, the solution is also going to save lives. Then lastly, the last slide, these are just an indication of what happens before. What women have to go through deploying some of the traditional home remedies to cure some preventable diseases. And then afterward, after seamless transition, this one is an indication of the result that we're going to see, the improved living standards and accessible healthcare services.